It's Local Edition. I'm Brad Pomerance in San Diego County. Today we are joined by Dr. Donald Kearns. He is with Rady Children's Hospital. If you live in San Diego, you surely know Rady Children's. Give us a sense about this dynamic, remarkable institution.
Thanks, Brad. Rady has been my entire professional life.
Really?
I've been there for 29 years.
Wow.
And was a surgeon there for 25.
What was your specialty, if I may ask?
Pediatric otolaryngology, which is ear, nose, and throat. Ear, nose, and throat. And have been the CEO there for about 3 years now. It's an incredibly dynamic organization. It was a polio hospital when it started in 1954. And if you can remember historically what happened in 1954, Jonas Salk cured polio.
Right.
So that was probably a poor business plan.
Right,
and we
right.
morphed into a children's hospital at that point. And it has started off as a fabulous, tremendous provider of clinical care to children. And we have evolved into a world-class academic medical center. We amalgamated with the University of California's medical school, in UCSD's medical school in 2001. Mm-hmm. And then we had a creation of something called a Medical Practice Foundation, where our physicians became faculty at UCSD in 2009. And the hospital is now the 5th largest children's hospital in the United States. So
Fantastic.
pretty incredible.
One of your specialties is your Institute for Genomic Medicine. We have a family friend whose child was born. When the child was birthed, there was clearly something going on with the skin, and they needed a geneticist to figure out what the story was, and this child wound up having a genetic condition called epidermolysis bullosa, which is a blistering disease. But for genetic medicine, it could have been a challenge, and this clearly is one of your specialties.
So this is something that is relatively new. We realized early on that we were in a unique position as a very large children's hospital with a very extensive patient base. We also happen to be in San Diego, which is the nexus of genomic medicine. If you can imagine, Craig Venter is here, the man who first sequenced the human genome. We have a number of companies and biotech firms that are specializing in genomic medicine. And we thought, what a wonderful opportunity to try and take this together and create an institute specifically around pediatric genomics. There's nobody that's done anything specifically around pediatrics up to this point.
And a fun fact, one of your doctors, Dr. Stephen Kingsmore, set a Guinness World Record. Who knew? But tell us about it.
Well, so this started off with our visit to our benefactor, Mr. Ernest Rady, who gave us $120 million to get this thing off the ground.
Okay.
So if you can imagine, that was an unbelievable opportunity.
A lot of money.
He basically lit the fuse on making this happen. Once that occurred, we realized we need somebody who was going to change the world for us, and that was Dr. Kingsmore. So Dr. Kingsmore has had a varied career in academia and in industry, but most recently was at Mercy Children's in Kansas City. Mm-hmm. And when he arrived here, he had at Mercy Children's set the world's record for the fastest genome in the world.
Meaning?
Meaning that you can sequence a human genome and analyze the data within a brief period of time. Historically, that's taken months and months and months. He was able to do it in 26 hours.
How?
It was basically using techniques that were here in San Diego, which was one of the reasons. I mean, when you think about the reasons he arrived here, Mr. Rady's gift was a big part of it. The reputation and the clinical strengths of the hospital was a large part of it.
I got to tell you, I'm being a little parochial. My wife has Crohn's and colitis. Her doctor, the one that really cured her, was at the Mayo Clinic. He's not there anymore. Guess where he is? UCSD.
Right, right.
So something's going on with UCSD and Rady Children's.
Absolutely, absolutely. And so all of these things, along with the fact that he had worked with Illumina
Right.
and Genomics, who are both companies here in San Diego, the combination of all those things allowed him to create what he called the Ferrari of genome sequencers and do this and turn it around. So his passion now is to provide this to the children in this area in our neonatal intensive care unit and our pediatric intensive care unit. So you can imagine those are the very, very sickest children that you want to be able to provide cures and diagnoses to in
Right.
the briefest period of time.
When you have a sense, like our friend,
Right.
there was epidermolysis bullosa, it wasn't clear. It took a little while. It took
Right.
a couple, maybe a few days or weeks. He's doing well, but still diagnoses are critical.
And that is so often true with things like AB, but if you could imagine how that would be true for a child who had a cardiac abnormality, that you'd want to be able to know what this diagnosis was right away.
I am proud to mention that Cox, one of the partners in this program, is a significant supporter of Rady Children's. Through our charity arm, Cox has given very significant dollars, close to and over $1 million if you consider in-kind contributions. Talk to us about the Cox Rady Children's Partnership.
So if I remember my numbers correctly, the partnership got started in the late 80s.
That's right, 88?
And you have been a tremendous partner and a real help in the community, both with in-kind contributions, helping us in the hospital with making sure that kids are entertained, but also actually providing fiscal support. So one of my favorite stories is about a robot that you helped us finance, and that allows us to be able to provide care to children at distance and be able to project images off to an additional robot where a physician can see what's going on. Some pretty incredible stuff. The other thing you have really been helpful around is providing child life. And this is one of the softer parts of taking care of kids. These are folks that make sure that a child is comfortable. If you can imagine, if you're a kid in the hospital, that's about the worst day of your life. Child life provides the ability for these kids to be comfortable. When they're comfortable, they do better, they get healthier. Their parents are healthier, their families are happier. It's great, and it's been a tremendous partnership.
And it's our pleasure for sure. Also big supporters of Rady Children's, the Padres. There's a yearly event, Padres Pedal for the Cause. Tell us about it.
Right, so Padres Pedal is a relatively new partnership. Pedal the Cause got started by Bill Coleman in St. Louis. Bill moved to San Diego and wanted to recreate Pedal here. The St. Louis Pedal still exists, but he wanted to recreate it here. And it started off as a partnership between UCSD, Sanford Burnham, Prebys, and the Salk Institute. And the idea behind this was to provide cancer seed funding, so money to researchers to help them before they could get grants, federal grants, to do research around cancer. So to go after the embryonic ideas around cancer. And early on in their process, they came to us and said, would Rady like to be part of this? And I thought, wow, look at these partners. They're world class.
And you'll come back and tell us more about it?
Yes.
Okay, his name is Dr. Donald Kearns of Rady Children's. I'm Brad Pomerance. It's Local Edition.